at the end of March, we had the news that that there was going to be a supply issue with the AstraZeneca vaccine, and this was a national problem regarding the first dose. Because of the supply issues, the instruction is actually pause first doses at the moment, unless there is a desperate clinical need, and that's pretty rare. That's things like chemotherapy or immunotherapy that need to start out of clinical urgency. So in terms of booking your vaccine, I can only really speak for our PCN, so 7Health PCN, and I think bookings vary throughout the country. With 7Health PCN, the situation is that primarily, with most people having access to a mobile phone and having one registered at their GP surgery, that phone number is used to give patients a message which contains a link, and it's by a company called Accurix, who incidentally have been fairly impactful in terms of new technology coming online over the last year that's helped us with COVID. So anyway, this company called Accurix is our sort of booking portal, and you'll get a message usually saying which dose this text is about. So when I had my second dose very recently, I got a text message from the booking hub saying, Dr. Mains, your second dose is ready, click this link to book in. And it tells you which site, which is Beaches Green, obviously, and click through it, and it becomes fairly obvious of how to do it. So that's the primary and most efficient way of doing it. But there are people who don't want to use a mobile phone or don't have one, and so we generally have contact details for our patients as a rule. So if we can't contact them by mobile, then there is a team that will be contacting people on their home phone. If we can't get people on their home phone, then we've been sending letters out, and this has been a huge piece of work, actually, trying to make sure you're contacting as many people as you can. And so one of the key lessons from this is, when you have the national booking option, so you want to go to Ashton Court or Bath Racecourse or wherever for whatever reason, then you can do that, and you book in via the national website. But if you're invited by your local vaccination site, then it really helps to go through that text and click the link and say, I don't want it, I'm having it somewhere else. Because the unfortunate thing is that these systems don't speak to each other. So the national centre and the local centres, the technology doesn't talk, and so when people are booked somewhere else, we don't know that that's the case unless you say, I'm having it somewhere else, which means that we invest time trying to contact people who don't need to be contacted. So that's one thing I would say about sort of the response. And if you have one appointment somewhere and you want to go somewhere else, then it's important, no matter which way it is, to cancel your appointment. So the administrator's side of it isn't sort of I guess wasting time, and the other part of it, there's a risk of wasting vaccine. The most important thing with this vaccine is, do not waste doses. The doses are designed to be given to people, so make sure they are all given to people. And we have worked really hard. The typical situation is, it's coming up to the end of a vaccination shift, and you get vaccines that come in vials of 6 or vials of 8 or vials of 10, and once you have gone into that vial, you must complete it. So there is a real job in trying to match numbers to vials, and not waste. So, you know, in terms of lists that we keep, essentially it's people who are next in the queue and people who could potentially have early seconds who are local. If it gets to 8 o'clock at night, you need people nearby. There's not a list that people can sort of add their names to. I think at the moment we have managed to sort of match that quite well, and there are always, you know, you're really talking about very small numbers, because, you know, the nurses who are in charge and the GPs who are in charge of each shift are watching like a hawk the vials as you get closer and closer to the end of the shift. Do we need to open that? How many have we got left to go? How many vials, you know? So it really is, yeah, drawing on people's maths GCSEs quite hard at the end of each shift. It usually takes sort of between 5 minutes and probably about 20 minutes to get through the vaccination centre, except for a couple of busy periods we've had recently. So hopefully it's not too much of a task to dip out of your barbecue and come and get a jab. There's often questions about, you know, which vaccine is it going to be on a certain day, and really the only there currently is no choice, and I don't foresee that changing, because as the system is already incredibly complex, and we're potentially getting more vaccine brands going ahead, introducing choice will probably end up meaning it's too complex and vaccine will likely be wasted. So there'll be delays and wastage because of the complexity of the system. So I don't foresee that being a thing that is offered. And the way I would sort of address questions about that is they are all incredibly effective vaccines. So, you know, if there's a clinical reason why you have to have or not have a specific vaccine, then that will be addressed, and via practice searches you'll be discounted from a certain group and added to another group, for example. But I would be reassured that it doesn't really matter which vaccine. Certainly at the moment they're all really effective. So yeah, choice is good, but in the context of a mass vaccination during a pandemic, actually expediency is really important. It's been a big job contacting all the people that really need contacting, that maybe are a bit harder to reach in the first group of cohorts. Yeah, I'd like to thank the team on how much work they've done to achieve that. I don't know the details for the PCN as a whole, but I know in my own surgery, out of cohorts 1 to 9, you know, we're well over 97% of people contacted. So I think the uptake, the sort of cooperation between, you know, us offering the vaccine and the population sort of, I guess, getting involved in their way has been phenomenal, you know, but better than any flu campaign.